for joining us today. My name is Grace Reese, and I am the Chief of Policy and Evaluation here at Child Care Aware of America. We used to be NACRA, the National Association of Child Care Resource and Referral Agencies, but we are in the process of changing our name. So we're Child Care Aware of America, and today we're going to talk about what's available for federal child care data. We have a website that I'm not sure if everybody's familiar with it or not, so I will begin by telling you on our website, which is www.nacra.org, which soon will change to something else, but there'll be a redirect, so don't worry about that. We have two main areas that include, I think, everything known to man about numbers having to do with child care. And those two areas are one called Public Policy Resources and one called Public Policy in the States. I'm going to show you both and kind of walk through what we have there and why. And at the end of this Lunch and Learn, there's a question box or a chat box, and if you have any questions, go right ahead and I'll see what I can get to, and if I don't get to it, then when the Lunch and Learn is over, I will for sure get back to you by email. So while my computer goes to this link, which I'm hoping won't be too long, and I'm pretty impatient, so if it takes much longer than this, I'm just going to open up my browser and go to what I was going to show you, and know when I post the slides from your own computer, you might be able to go to this link pretty quickly. But it's apparently not fast enough for me. So you're seeing my screen, and I'm going to use a different browser. And quickly, go to NACRA.org. I'm going to click on Public Policy. I'm going to go to Resources, and that's the link in the slide. This is where you would have wound up at. And so I want to tell you a little bit about what is under Resources and why we put these things up here. The very first tab under Resources is called Data. And under Data, here's what we did. I worked in the Senate for 16 years, and when I worked there, you always have a need for little facts, factoids, tidbits of information. So in designing what we put under Data, it is a little bit broader. It's not just numbers, but it's all the information that's out there related to numbers in some way related to child care. And the purpose that we put them all in one place under this concept called Data, under Resources, under Public Policy, is so, say you're writing a grant application, or say you're writing a press release, or say you're writing a memo of some type, or say you're going to a community event, and you just want to know things like how many working women are there, or what's the % of moms with kids under 1 with infant who are working today. But anything that's related to really child care in some way, we tried to put on our website, and most of that is under Data. And there are a few other areas where I'll show you where that information is as well. So beginning with the Child Care and Development Block Grant, which is the basic law that allocates funds to states for child care and sets the parameters for state laws, people might want to say, well, how many kids receive a subsidy, and what are the settings that those children are in? Is it licensed, not licensed? Is it a family child care home? Is it a center? Is it unlicensed care, but maybe it's with a relative, or maybe it's with a friend and neighbor? Or what's the average payment for the country? Or what's the average co-payment? All of these things we link to, and I'll show you. We're going to click on the first one. We link to the HHS website to answer those questions. So these are HHS tables. This information that comes from the states. And the most recent is fiscal year 2010. We're actually currently in fiscal year 2012, so I'm sorry we can't do any better, but it's not us. It is the lag time between the time the states spend the money, the time they report it, and it's aggregated by HHS, and then HHS puts it up on their website. We will link to updates the day it's available. We are pretty good at keeping our site up to date, but the most recent fiscal year is fiscal year 2010, and as you can see, there are about 1.69, so about 1.7 million children whose care is paid for through the Child Care and Development Block Grant, some type of subsidy. You can also see the average families. It's state by state. I'm going to go back, and we have the average monthly percentage of children by age. You can just see it's a neat table. It's easy to read. About a third are school age. The remainder are, under school age. You can see the percent of children served by in different types of care. You can see at the bottom, predominantly, if you look at 24 and 5, so 29% are in some type of home environment, a large family child care home or a small family child care home, and about 66% are in centers. You can see average monthly number of children served by racial group, and obviously these numbers are by state. It's about even between African American and white children, Caucasian children. You can see child care settings by type. I think I showed you that in a different one. Oh, those are the numbers of kids by type. You can see expenditures. These are just average. In 2 weeks, probably 2 weeks, we're going to come out with a price report, which is a publication we put out once a year. State by state lists the cost of care in the community for infants in a center and a family child care home, and 4-year-olds in a center and a family child care home. And those rates vary by state, but we're reporting not on the use of subsidy, but we're reporting on the market rate. What's it cost in the community? What's the average cost? So that report is now at the printers, and we'll be out with it in 2 weeks, and you can then take a look and see how does that compare to the subsidy. We actually are going to be putting out a paper on that in maybe about 3 weeks, but shortly. You can look at the copay. If a subsidy is provided in the state and that is, $50, it may require a copay, or it may require a gap between what's the market rate, what's the copay, and that difference has to be paid by the family if there is any. So this is information about that. Children in licensed versus unlicensed settings. You can see state by state that varies. Overall, about 19%, maybe almost 1 in 5 kids are in an unlicensed setting paid for by the Child Care and Development Block Grant. We know in 3 states, Michigan, Hawaii, and Oregon, that over half of the children whose care is paid for by CCDBG are in unlicensed care. And we know in 10 states, 30% or more of the children who are in care paid for by CCDBG are in unlicensed care. And this is the table that shows that. What we do once we look at the data is then we take the data and we combine different columns. So for example, this particular table is a table that shows the average number of children, which we got from one of the HHS tables, the percentage served in licensed care who are receiving a subsidy, and we got that from one of the tables, and the percentage that are in legally operating without regulation, which we got from one of the HHS tables. And then we made the calculation and say, okay, so this is the number of children in unlicensed care by state based on the information that HHS gave us. It's not an HHS table, but it is basically from HHS data, and below we cite the tables that it came from. It's kind of interesting. 322,000 children are in unlicensed care where the subsidy is paid for by CCDBG. And the only distinction there is that's the care that we just don't know anything about. It's not licensed, so there's not a background check, it's not licensed, so there's no minimum training, there's no minimum health and safety, there's really no inspection. Although in some states, if there's a complaint, they might send somebody out. But also in those states, they may or may not have the authority to close people down if they're, operating in unlicensed fashion. That varies by state law. So in any event, I just wanted to show you we have both tables that are available because HHS puts that data out, and then we also have tables that we've created from the existing federal data that might be in separate tables and brought them together so that you can see how, when the information is integrated, what that means. So then we also have some other information, like child care eligibility by state, and this document is actually from the National Women's Law Center. They did the research on this, and we cited them at the bottom. You can see National Women's Law Center. But basically, this was a reflection of waiting lists for 2011, but I believe the National Women's Law Center will be updating this report. They come out with it every September, so in September we'll be linking to a new document. But not all states have. Oh, this is income eligibility. Sorry, we have one that's on income eligibility, which we got from the National Women's Law Center and cite them, and we have another one which is waiting lists, which we also got from the National Women's Law Center. And those waiting lists are from earlier, like February of 2011. But National Women's Law Center will be coming out with a new report in September, and they always look at waiting lists, income eligibility, reimbursement rates, and so we will be linking to that information as well when their report comes out. On the waiting list issue, now that I have that table up, just to be clear, not every state has a waiting list. So first, a state has to authorize the use of one, and then that's about half the states, a little less. And then of those states that authorize one, some of them will grow it forever as long as people who knock on the door and who are income eligible put their name on there. But others freeze it. You know what? We're freezing intake. We're going to freeze names. We're not going to take any more names. We've exhausted our funds. Therefore, they may have a waiting list, but it's not growing, not because there's not need, but because they've made a policy decision that they're freezing it. And still other states may decide, oh, we're only going to put TANF families, temporary assistance for needy families, on the waiting list, or they may make different decisions. So when you do look at waiting lists, you have to understand what's the policy behind the keeping of that one. Or if you see, for example, DC, no waiting list. That doesn't mean that the demand doesn't, exceed the amount of subsidy available. That means that DC probably doesn't keep one. So in the good to know information category. Moving down, cost of care, average monthly payments. I showed you that already. Those are the HHS numbers. This one on average annual subsidy payments versus the cost. This is from our report, our price report that I spoke about that we do once a year, and we're about to come out with a new one. And what we did was we took the subsidy number, so you can see Family Child Care Home Subsidy from HHS. That's an annualized number, and we compared it to the annual cost of care from our report. And you can see that the amount that the subsidy covers is, far below the market rate. And we did the same for center care. If you keep going down, I'm kind of watching my watch a little bit just to see, so I might show you more about what we have rather than open everything, only because I see we usually try to keep these to 30 minutes. On the supply, it's the same kind of thing. When the federal government, some part of the federal government puts out something about supply, we're linking to it or we're combining information. 2010 Census Bureau data. I will show you that because you can see, for example, where are the kids? Where are they by, age of the parent, employment status of the parent, race of the parent, hours, whether it's full-time, part-time, are they in non-traditional hour care or, regular working day care? But we link to all the information that I think you could possibly think of so that you have what you need. Hang on. I'm going to flip to very quickly. Page is frozen, but hopefully shortly it'll come up. We link to not just HHS, but also the Bureau of Labor Statistics, and also the Census Bureau, and also we have links to TANF data. So cost of care, child care funding overall, this is a link to HHS, and I'll just show you in general so that you understand what you're looking at. But this is the expenditure data. So the child care money goes to the states, and they have to report how it's spent. So it comes in categories, and overall you can see basically there's about, in total expenditures, there's about, this is 7, and including mandatory. Let me tell you a little bit about mandatory and matching. See if I can find a better chart on that. All of these tables are up here, and we link to them. When you look at mandatory and discretionary is the money that's appropriated from the from Congress, House and Senate Appropriations Committee. It's about $2 billion. Does not need to be matched. And then there are 2 other categories of child care spending, and that is what's called discretionary and matching. And so there's mandatory money, and how much is that overall? It's about $2.9 billion. What happened in 1996 is there were 4 funding streams for child care. One was discretionary, which came through appropriations. The other 3 were through the Senate Finance Committee and the House Education and Workforce Committee. It was called mandatory money because it was attached to certain programs. Like there was a program called AFDC, Aid to Families with Dependent Children, and that was an entitlement welfare program where if you made under a certain amount of money and you were required to work, then they would have to use AFDC money to pay your child care. Then there was a stream of money that was called transitional child care, TCC, and that was for people who were working their way off AFDC in a job but really weren't self-sufficient. And then there was a third program that was called at-risk child care, and that was also through those 2 committees, Finance and House Ways and Means. And that money was helping families who were at risk of going on welfare. And so when you totaled those 3 streams together, today it's about $2.9 billion, but it was all consolidated into one pot. And so you have $2 billion that's appropriated, which is called the discretionary money, and then you have the mandatory money, which is about $2.9 billion, and some of that money has to be matched. Basically, the first $1.2 billion, which represents what was paid out of AFDC, is free, and the money on top of that has to be matched, and it's at what's called the Medicaid match rate. So in Mississippi, they pay 20 cents out of every dollar. It's an 80-20 match. But in Maryland, where it's kind of inversely related to poverty, so compared to Mississippi, Maryland has fewer poor children as a percentage, so their match is 50-50. So you get all your money if you put up the match. And so what this is showing is, you know, there was matching money, there was mandatory money, there was discretionary money, there was subtotal, and where does that bring you? MOE is maintenance of effort money. What happened in 1996 is when they consolidated this money, they put a little bit more in, and they said, but states, we're not going to give it all to you unless you at least spend what you were spending before welfare reform. And so states kind of have it's called a maintenance of effort. They have to prove what they were doing before so it doesn't become a total shell game and they're supplanting. And so altogether it's about $9.4 billion, which is a lot. And that doesn't even include TANF. So let me see if I can show you the TANF tables that we have and talk about that a little bit. I'm not going to open them. I'm just going to show you that we have them. But basically, by law, TANF, the Temporary Assistance for Needy Families Program, which is a block grant that goes to states, states by law can transfer up to 30% of that money over to child care, and then it follows the child care rules. Or they can spend money directly from TANF on child care. And if they spend money directly on child care, that's fine. They just don't have any rules because they're not transferring it. And once they transfer it, CCBG doesn't have a lot of rules, but has a few, like data reporting. And there is no data reporting out of TANF. So what I can tell you is about $1.1 billion is spent out of TANF directly on child care, but we don't know how. We don't know what the average payment is. We don't know the setting. We don't know licensed or not. We don't know the ages of the kids. All we know is $1.1 billion. It serves about 800,000 kids, and that's all we know because that's all the law requires. We would like to see more consistency so that the same data collected from CCDBG, the Child Care and Development Block Grant, is also collected from TANF, which we'll be working on in reauthorization. But for now, we give you access to everything we know. And these tables are actually state by state, so you can see what did my state transfer to CCBG? What did my state spend on child care directly? And it's kind of interesting because there's great variation. There's about $700 million was cut from child care 2 years ago because states decided to spend less out of TANF on child care. And this year, they bumped that back up. So we're not really where we are on child care spending where we were 2 years ago, but it's on the increase this year. And you can see those in this tables. I wanted to show you a few more things, though, so I'm going to come down here and just show you. So this is all about funding. This is numbers of kids in Head Start, number in state-funded pre-K, number in programs sponsored by the Child and Adult Care Food Program, the Nutrition Program. Then we have everything you'd want to know about mothers in the workforce. Those are links to Bureau of Labor Statistics documents. And then we have everything about poverty. And so with that, I think I'm going to flip over here to policy issues and show you all of these areas are policy issues, but they're also everything that we have in our data sections also comes under the category. So if you wanted to crosswalk that over, you would see it. If you click on in the states, you come to a map. And if you click on, let's take something in the middle of the country, Kansas. Okay. So if you take Kansas, you will see, okay, in Kansas, we have an R&R network, and there's Facebook, and you would see we have some parent leaders, and you would see there's the governor, there's the state legislature, that's their session. You would have a link to the licensing department. And then where the data is really is We Can Do Better, which is a report that we do every other year on state laws with regard to child care centers. We're actually working on the update to that document now, and it will be released in March of 2013. And Leaving Children to Chance is a review of state laws with regard to family child care homes, and we just released that in March. And so you can see, you know, the like 15 really important basic things with regard to child care, like CPR or health and safety or training. You know, how does my state rank? Because we look at the criteria, we score and rank the states. We've got a top 10. We've got some scoring 0. There are 8 states that decide to give a license to states without inspecting them first. They get a 0. We think before you issue a license, you ought to check to see just where the location of that setting is and whether or not it's decent and won't harm children. Anyway, and then I'm going to click on this because it's a state fact sheet. So everything you'd want to know with regard to child care and kind of working parents is also there. So let's come back to, that's it for data, mothers in the workforce, poverty. I will also show you under About Child Care, we have a state licensing section. Everything you'd want to know about these various categories in licensing, they're state-by-state tables. Also, a link to the state child care fact sheets brings you back to the map. Also, we have, let's see, a link to state fact sheets here, which is under data, and that's state by state. The fact sheet's like the one I just showed you for Kansas. So you can get to them two ways, one through the map, or two coming to the state fact sheet page. So I know we're running out of time. We have a lot more things on our website, but I guess the bottom line is we really have a lot of information from federal agencies on our website. We've tried to distill it and put it in a user-friendly format. We've tried to have a gateway so that it's logical and makes common sense and you can connect it to all of the work that we do. And we're always looking for things that we don't have to add them. So if you have any ideas, you can always let me know. And also to let you know, I think as I said before, anytime a federal agency updates their data, we obviously update ours and update our links to them. So with that, I know there's not a lot of time, sorry about that, but I would like to take questions if you have any. So I don't see any questions right now. Is the information on the site available for distribution in the early childhood community via newsletters and trainings? Great question. We actually have a newsletter. It comes out every week. It's called Capital Connection, and I will send you a link after this Lunch and Learn about how to sign up. But if you want to sign up, you can go to our website, and in the bottom right-hand corner, you can click on Take Action, and you will see right in the welcome message if you want to get our newsletter and sign up for our action alert. Anytime we put anything on our website related to policy, related to licensing, related to data, if there's a policy connection, it's going in Capital Connection, which is our policy update, our weekly policy update. We really have a lot of things on our site, and I talk pretty fast just because we try to keep it to 30 minutes, and I wanted to get in as much as possible. But if you do have any questions, is there any data by county? You know what? We don't have county data. We only have state data, but you can get county data from the Census Bureau site, and you can use FactFinder. And if you go to our website and you click on webinars, which is under policy, and I think they're called policy webinars, you can see that we did 2 Lunch and Learns, and they're posted to our site, and you can watch there might be 2 or 3 slides. It's mostly live on the Census Bureau site. But you can see our walkthrough, how to use FactFinder, how to find information about your community, by county, by zip code, and there were 2 Lunch and Learns on that. And if you watch those and you have additional questions and you shoot them to me, I will for sure get back to you. Let me, somewhere here I have a slide that gives you my email. So all of the links here are basically links that are 2 things on our website that either link elsewhere or take in the tables and source them. We also have something called Excel for Advocates. Some people, it's been a while since you've been in school, and, what's a fraction, what's a rate, what's a percent increase, how do you do that again? This is a basic Excel for Advocates Math 101 designed to help anybody really portray in numbers what you might say in words. And, for some of us, the words might come easier than the math, and this is why we developed that document. And hopefully it's helpful. Will you be sending the slides? I actually will be posting the slides to our website. I'm recording this now. But I will post the slides, and they're easy-to-use links. The way our website is set up, I think there's some security, and it's slower and not so good maybe on the links for a webinar. But all of the links are in the slides. It's not a lot to go through. It's basically a couple of different gateways, and I will definitely post them. Does the website have demographic data on parents and providers in the license-exempt child care system? For example, education of license-exempt providers. That's a great question, but it doesn't, because unless I have access to that information from somewhere that collects it, I can't share it. I mean, I would love to know that. I have a lot of data on this website related to the information collected by the federal government, I have a lot of data on this website based on our own surveys. We've done a training survey in the field. But we don't have consistent data about licensed exempt care beyond, frankly, the children whose care is paid for in licensed exempt care, because we can track it by the subsidy use. But we don't know anything about that care. We don't know the training of any of those providers. You know, and that would be the first thing that I would tell parents. Here's what I know about, you know, this family child care home. Here's what I know about this center. These are laws in our state, but this licensed exempt care, some states have a separate standard. Like in Indiana, they have a much lower than licensing standard for religious-based or religious-sponsored care. They call them daycare ministries. They don't meet licensing standards or a lower standard, but you would at least be able to tell parents, you know, they do this or that, which is not at the same standard of licensing, and here's what licensed centers have to do, here's what licensed family child care homes have to do. But short of, you know, our requirement to collect that information, you know, I wish we had it, but we don't. We're actually working on a white paper on licensed exempt care, and we're in the process of trying to pull every little tidbit that we can find out about it so that we can share it and have a kind of better picture of where this is and how many children might be in it, and, you know, what the condition of that care is, and whether children are safe, and also to the extent we can find out who's using it. You know, is it primarily used for those who need care in non-traditional hours? Is it primarily used by those who can't afford other care? Is it primarily used because that's a parent's first choice because they love their neighbor and that's what they want? Very unclear. I would say, you know, we're doing a kind of lit review to figure out what the research says to better inform us on this issue. And so with that, I want to be mindful of your time. And if there's any question you think of that you didn't get in our brief 30 minutes, shoot me an email. I'd be glad to answer it. And at the conclusion of this Lunch and Learn, we will be posting the slides, which there's only 2 or 3 slides. It's mostly links, but hopefully the links will be helpful to you. Thanks for joining us. Bye.